Well, good afternoon, everyone. We have quite a few people who have joined us perfectly on time or early. I'm sure others will come in, but I'm going to go ahead and get started so that we're being respectful of everyone's time. My name is Patricia Julianelle. I work with an organization called SchoolHouse Connection, and we are partnering with some fantastic Nevada organizations who are going to have the opportunity to introduce themselves in just a second for this webinar on a new state law passed back in 2021 called AB 197, which helps to facilitate access to healthcare for unaccompanied youth who are under 18. Before we even get started with more introductions, I'd really like to go ahead and turn the floor over to Assemblymember Howard Watts. He was really the force behind AB 197, and I think he wants to say a few words to us about the law and his role in it. And welcome, Assemblymember Watts. We're so happy to have you with us.
Thank you so much for having me, Patricia. Good afternoon, everyone. Thank you for taking the time to join this webinar and learn more about this important piece of law that we passed last year. I want to thank SchoolHouse Connection. I had the chance to connect with that organization at the National Conference of State Legislatures in 2019 during a kind of a breakout session focused on policy to assist youth that are facing homelessness, and really want to also thank the Nevada Partnership for Homeless Youth. I was born and raised here in Las Vegas, have spent most of my career in advocacy and community service, and have known and worked with the partnership in a few different ways throughout the years. And really, they've been not only incredible in the services that they provide to our community and to our young people, but and the way they lift up the leadership of young people, which I think is really incredible, but have also been great advocates. So, really, this is a partnership between NPHY and myself that led to AB 197 being created and passed into law. Their staff, but also their youth were critical in helping advocate for the bill and helping shape the policy itself. And so, it's important to me. Working on these issues is not only something that I've had personal interest in for a long time, but I also feel that it's one of the ways that I'm helping carry on the legacy of a colleague of mine, Assemblyman Tyrone Thompson, who unfortunately passed away a couple of years ago, and was a true champion on these issues. And so I'm happy to help pick up the mantle and serve as kind of a helper in working with these organizations and getting great legislation like this passed. To me, one of the things that gets talked about a lot is the idea of healthcare as a human right that everyone's entitled to. And we have to make sure that when we look at a lot of the other big and important policies around healthcare, that we also pay attention to things like this to make sure that when young people are in a situation where they need to access this care, that we don't have legal barriers that are getting in the way. And so this was, again, informed by the experiences of young people, with NPHY. It was really my honor to help lead the effort to introduce this bill and get it passed to address this. And so, again, thank you all for taking the time to learn about this and how we can implement it to make sure that young people get access to the care that they need. And thank you to all the organizations today for putting this together. It's great to pass a bill, but the most important thing is that we get it implemented. And I think that's what today is really all about, is making sure that people have the knowledge and understanding to take this law and put it into action for the benefit of our community.
Thank you so much, Assemblymember Watts. It's really an honor and a pleasure to have you here with us for this webinar. So thank you. I understand you might not be able to stay for the whole thing, but you're welcome, very welcome, obviously, for as long as you want to be here. So as I mentioned, I'm with Schoolhouse Connection. I won't spend a lot of time talking about the organization, but you can see us on the web and access some of our resources there. I'd like to turn it over to our friends at Nevada Partnership for Homeless Youth to just give us a quick introduction to who we have on the call today from your organization and what you do.
Absolutely. Thanks so much, Patricia. And thank you again so much, Assemblymember Watts, for joining us today and for all of your support and advocacy and everything that you did to make it possible for this bill to become law in our state, which we're very excited to share with everybody on the call today. So my name is Melissa Jacobowitz, and I'm the Chief of Development and Strategy at Nevada Partnership for Homeless Youth, or as we call it, NPHY. We're located here in Southern Nevada, serving the Las Vegas community, Clark County, the whole Southern Nevada region. And basically, we do anything and everything we can to serve young people experiencing homelessness and to really work on a plethora of solutions to the issue, the very complicated and devastating issue of youth homelessness here in our community. And on today's call, we have a couple young people that we work with on a regular basis. One of the young people that we work with, we actually collaborate with our community's youth action board called Young Adults in Charge. And we have here the outreach coordinator for Young Adults in Charge, Teresa. If you'd like to, Teresa, say a couple words and introduce yourself if you'd like.
Hi, everyone. Yeah, my name is Teresa. Sorry, I'm like on the spot. Yeah, so Young Adults in Charge, the main goal of Young Adults in Charge is to make sure youth voices are heard. And we also we did collab with NPHY at Master's Program as well to help with the bill and passing of this bill and making, and yeah, it was a fun process. It was, I'm so sorry, but yeah, we was able to edit it and lobby for it. And I think personally, this is my favorite bill that we have passed so far. I say so far because there's more to come. Because this is the first bill that gave youth autonomy and actually have the say over their lives and how they want to be treated. And I love the fact that it gives protection over with the healthcare providers and youth. I think this is awesome.
Absolutely awesome. Thank you so much, Teresa. So sorry to put you on the spot like that, but that was great. We really appreciate that. And exactly, our young people were very involved in getting this bill passed, from giving feedback on the bill draft, the draft language of the bill, to actually testifying to committees, to writing letters of support for the bill and doing social media outreach, et cetera, to really get this bill passed. And then we also have another young person here with us today named Naraya, and she is actually a client of NPHY. She lives in one of our housing programs. Naraya, would you just like to say hello?
Hi.
So,
Do I introduce myself? I'm
sure,
sorry.
if you'd like to. Yeah.
Hi, I'm Naraya. I'm a member at NPHY. I'm used to be in the ambassadors program. Yeah, it's been a really good experience here. It's a lot of help.
Awesome. Awesome. Yeah, that's great. Thank you. Thank you so much for sharing that. Yeah. And so Teresa and Naraya will be participating in the role play we do later, and also available on the roundtable to answer questions, etc. But yeah, thank you so much for having us. We're really excited to be here. And just like Assemblymember Watts was talking about, NPHY, we're of course a high quality direct service agency that offers very comprehensive direct services to unaccompanied young people experiencing homelessness here in Southern Nevada. But we also know that if we really want to make an impact on this issue and move the needle in a serious way, that we also need to be involved in systems level work and advocacy and policy work. And so we're very involved in the passing of this law, and we're excited to share with you today how healthcare providers and other youth homelessness providers can help young people to access all of the rights that are afforded to them through this law.
Awesome. Thanks, Melissa. Now I would like to turn it over to our friends from Legal Aid of Southern Nevada to talk a little bit about your organization.
Am I the only one on the panel from Legal Aid? I think so.
I think so.
Yeah, my name is Fernande Rossetti. I'm an attorney with Legal Aid Center of Southern Nevada, which I'm sure as many know is a private not-for-profit organization, which provides legal counsel, advice, and representation as set in our mission statement to individuals who are unable to protect their rights because they cannot afford an attorney. Specifically, I am with the Children's Attorneys Project, and our division represents all children that are in the child foster care system. So all children that are abused or neglected are represented by our part of Legal Aid of Southern Nevada, except for the few that are represented by, thankfully, our pro bono council partners. So.
Great. Thank you, Fernanda. I appreciate that. It's been such a pleasure to work with both of those organizations for today. Let's tell you a little bit about what we're going to do. We're going to try to make this interesting and interactive. So we've got a poll to start and end. We're going to hear a little bit about unaccompanied youth homeless in Nevada and the basics of just the law of AB 197, what it actually says and doesn't say. And then we're going to do some role play scenarios to really give you a feel for how this law can and should work in practice. And then we will have a round table where we can entertain your questions. So I'd like to encourage everyone to type in questions as they come up as we go. You can keep typing them into the Q&A at any time. Just know that we will hold them until we get to our Q&A period towards the end of the session. But you're welcome to type those in at any time, and then we'll get to them towards the end. But let's start with a quick poll, if I can launch this correctly. So hopefully you're seeing that poll. We just have 3 quick questions for you there. We'd love to know what type of provider you are, what kind of role area you represent. We'd love to know how you would rate your familiarity with AB 197. I'm sure some of you are already experts, and for others, it might be the first time you've ever heard about it. So let us know where you fall on that spectrum. And then our third question is, have you ever actually had the experience yet of using AB 197, of treating a patient under that particular law? So thank you for answering. I can see the answers pouring in, and I'll give you a minute or two to go ahead and finish up the poll. Okay, looks like most people have participated. I'm going to keep the poll open for about 10 more seconds and then shut it down. Okay, I'm going to close down that poll. Thank you so much for all of you who had the time to respond. Looks like behavioral health winners behavioral health providers are the winners in terms of just the numbers of different kinds of professionals that we have on the call today. Everyone is welcome, and I'm so happy to see that we have quite a variety here. A lot of people are new to this, so that's fantastic. That's why we're doing this webinar, so welcome. Really glad to have all of you. And we actually do have at least 2 providers who have treated a patient using AB 197. So that is wonderful. You're our experts here. And then a lot of you, again, it's new to you, and that's wonderful. That's why we wanted to do this webinar. So thank you all for doing the poll. And now I'm going to turn it back over to Melissa again to give us a little bit of a background about unaccompanied youth homelessness in Nevada.
Absolutely. Thank you, Patricia. Yeah, so unaccompanied youth homelessness in Nevada, right? So what was the reason why we knew that this law needed to be passed, right? And something that I will say is, as NPHY, as a direct services provider for unaccompanied young people experiencing homelessness, we kept seeing young people facing these barriers, that we had these really great partners who wanted to serve our unaccompanied minors experiencing homelessness and provide them with healthcare and mental health and behavioral health and all kinds of services, but they were having trouble understanding or interpreting or knowing how to do so with current law existing without facing liability, right? And so our case managers were bringing this to our attention, our young people were bringing this to our attention, and that was kind of what inspired the work to do this. And that really has to do also with unaccompanied youth homelessness being a major, severe, and significant problem here in Nevada. And nationwide, a lot of people might be surprised to hear, 1 in 30 young people nationwide throughout the United States, ages 13 through 17, experience some form of homelessness over the course of a year. Those numbers are actually even higher for transition age youth, ages 18 to 24. But of course, today's law specifically is for unaccompanied minors. So we're focusing on our minors who are experiencing homelessness. And in 2019, there were 312 identified unaccompanied minors experiencing literal homelessness in Nevada on an average night. So what that means is that younger than 18, right, younger than 18 years old, that on one night there were 312 minors who were separated from their families, their parents or legal guardians, experiencing homelessness on the streets or in a place not meant for human habitation, or staying temporarily in a shelter. Right. And so that's a lot on an average night, right? Over 300 in the state of Nevada, minors separated from their families on their own experiencing homelessness. And so why might a minor experience homelessness separated from their family, right? And it can be a lot of different reasons, but a lot of times it has to do with severe family breakdown and instability. And that can include things like abuse or neglect or abandonment. That can sometimes include things like parental incarceration or illness or death, or even deportation, right? Struggles around immigration, things like that. That can include even issues related to falling through the cracks of the child welfare system, which can come up in a variety of different ways. It could also be economic instability that the family is experiencing that results in sort of a breaking apart of the family. It can even be things like young people coming out of the closet to their families and getting kicked out of the house, et cetera, et cetera. So there are many reasons why a minor or a young person might experience homelessness on their own, separated from their families. And in fact, the young people who are experiencing this, we know both nationwide and here in Nevada, that LGBTQ plus youth and also Black, Indigenous, and other youth of color are much overrepresented than their peers among young people experiencing homelessness. They're much more likely than their peers to experience youth homelessness. So we know our most vulnerable young people are experiencing homelessness most often. And when it comes to unaccompanied minors, we know that they have unique needs and face distinct barriers compared to transition age youth, our 18 to 24-year-old youth, who are still young people and still need distinctive services directed toward their experiences. But we know that minors have some unique needs and barriers as compared to transition age youth and compared to adults experiencing homelessness and families where the parents or legal guardians are together with the young people. And some of those barriers that these young people face have to do, right, with these legal issues of a young person who is separated from their family due to abuse or neglect or abandonment, or another issue where a parent is not going to be available to provide consent for vital services. That's a whole other issue that all of the service providers need to be aware of, and that minor is going to face over and over again when trying to access all different kinds of services, right? And we know that young people on the streets experiencing homelessness, they're more likely than their peers to experience all kinds of physical and mental health trauma. And that's why it's so essential that we're able to connect these young people to these healthcare services, right? They're more likely to experience physical illness and injury. They're more likely to experience assault and sex trafficking. They're more likely to have negative mental health outcomes, even things like attempting suicide, et cetera, et cetera. So it's very, very dangerous for young people living unaccompanied on their own out on the streets. And, without targeted interventions, they're also more likely to experience disconnection from school, which can result in lifelong reduced earnings potential. They're more likely to experience incarceration, et cetera, and they're more likely to become chronically homeless adults. So accordingly, it's very, very important, and it really is very helpful and has a huge return on investment for our community to get in there and serve young people when they're still young, before they become chronically homeless adults. And that's why this law is so important, because something so simple as a cut that doesn't get treated and then becomes infected, and then a youth ends up in the hospital or something like that, when that could be prevented and we can get them into services and we can break down those barriers, can really affect the entire trajectory of their life and how that affects our overall community as well. So that's why it's so important that we serve young people now as soon as we can, and this law makes it possible for us to do that.
Thanks, Melissa. I love your passion, and I agree totally. So Melissa got to give us some information about youth homelessness generally. I'm going to give us some basic information about AB 197. I'm going to go over it pretty quickly. And so I just want to make sure that everyone's aware that in the chat, there is a link to a folder where you can access this PowerPoint, and you can also access a lot of handouts. We have a Q&A on AB 197. We have a flow chart on AB 197, some sample letters. So even if we go over this pretty quickly, know that you have more resources that are at your fingertips, and also that, of course, we are going to have Q&A time later. So feel free to type your questions in. So a quick kind of 101 of this law. So what this bill did, AB 197 is a bill number. It refers to how this bill kind of went through the legislature, but it actually.
Oh, recording's progress. I think Patricia is signing back on. You know what? I
Hi,
wonder if,
everyone.
oh,
I
there you go.
apologize for that. My internet completely went down. I had to unplug it and replug it in and the whole thing. I apologize for that. It looks like we still have our participants here and everyone can hear me okay?
Yes, we can hear you. I shared my screen of the PowerPoint and we were attempting to continue, but I can unshare my screen so you can reshare your screen again.
Okay, and we will just keep on rolling. Again, my apologies. It was such a great webinar until everything fell apart. So let's go ahead. I'm going to share my screen again, and we're just going to keep on going here.
There you go. Perfect.
Okay, so here we go again. AB 197, of course, amended an existing Nevada statute section 129.030. It was passed in 2021, as we heard Assemblymember Watts mention. But actually, this law actually dates back to 1975. So it's not a new concept in Nevada at all. It's actually something that's been in the law for quite some time, and probably a number of healthcare providers have been using this for years and years. This is what it looked like back in 1975. I don't want to spend a lot of time on this because I don't want to get you to get confused, because this is the old version, of course. But like I said, it's been around for quite some time that minors can consent for healthcare services in certain circumstances. So let's look at what AB 197 actually changed, or what it says. And we've been talking a lot about youth homelessness because of the missions of our organization, and because that is a population that can really benefit from this law. But it actually applies to a lot of young people under 18, whether they're experiencing homelessness or not. That's not actually a required criterion. So who can consent under this bill or this law? Well, it's any minor person under 18 who is living apart from parents or legal guardian, with or without that parent or legal guardian's consent. So whether they may have been kicked out of their home, abandoned, run away. It also covers any minor who's married or has been married, any minor who's a parent or has had a child, or any minor where, if the healthcare provider believes that there's a danger of a serious health hazard if healthcare services are not provided. So there's actually 4 different categories of youth who are covered by this law. And we're going to focus mostly on that first category. Again, like I said, since we're really focused particularly on youth who are experiencing homelessness on their own. Now, in order to sort of show that the youth is eligible to be covered by this law, there are a number of ways that the healthcare provider can know that the youth actually is living apart from a parent or guardian. And one of the easiest ways is for the youth to provide a written statement saying that this youth is a minor living separately from parents or guardians, and that statement can be signed by a number of different people. And all this language is directly from the law, just so you know. So that written statement could be signed by a government agency or a nonprofit organization that provides services to youth experiencing homelessness. That letter also could be signed by a school social worker, a school counselor, or what are called homeless liaisons. Every Department of Ed, every county in Nevada has a homeless liaison, so that person also could sign the statement. The statement also could be signed by an attorney who's representing the minor in any matter. It might be something related to juvenile justice, child welfare, family law, really anything, immigration, whatever. Now, if you have a young person who's living apart who presents you with this letter signed by one of those service providers, what can they consent for? Well, the law says physical, behavioral, dental, or mental health services. So it's really a very, very broad categories of the different types of healthcare, including, of course, behavioral and mental health care that a youth can consent to. And the only caveat is really, you want to make sure that the youth understands what that treatment is about, the nature and purpose of the examination or the services. So basically what a healthcare provider would want to explain to anyone, here's what I'm proposing that we do, here are some of the possible consequences of that, and that the youth is requesting that service. So obviously we're not forcing anything on the young people. They're coming in and they're voluntarily requesting the service. Now, what providers are covered by this law? Well, again, it's a pretty broad list of different kinds of providers. Anybody with a local or state health office, a board of health, any licensed provider of healthcare. So that's a pretty broad category right there. And then also any public or private hospital. So you can see that the intention of this law really is kind of all about breadth. It's going to cover as many young people as possible, as many types of treatment and examination as possible, as many types of providers as possible, because the whole point here is to help young people be able to access the healthcare that they need. Do providers have to contact a parent? So we know that they don't need consent because that's the whole purpose of the law, but do they still have to contact a parent? The answer is no. So there is some language in the law about making reasonable efforts to obtain the consent of the minor to communicate with his parent. So saying, would you like us to contact a parent? It might be a good idea to get to get an adult to talk to you about this. But that's it. There's no requirement that the minor say, yes, you can contact my parent. There's no requirement that the minor contact the parent. The health provider does not have to contact the parent. And in fact, it's very specific that the provider shall not delay or deny the examination or services if the minor refuses to consent to communication with the parent. So again, this is really about a relationship between the youth and their healthcare provider. And parents are really not going to have to be part of that because, again, remember, these are youth who are not living with a parent. They're living separately from a parent or guardian. And I do see we have some questions coming in. That's great. Please do keep putting your questions into that Q&A box because we are going to have time for Q&A in just a few minutes. Who pays for these services? That question comes up a lot, and the law actually does have something to say about that. For any services where the parent or legal guardian has not consented to the service, they're not going to be liable for payment for that service, except there's a specific exemption that for emergency services, whether there's consent or not, regardless of the situation, parents and legal guardians will be liable for emergency services to the minor. Now in practice, at least in terms of young people experiencing homelessness, most of them are eligible for public insurance. They're on children's Medicaid in Nevada. And so those services would be covered anyway through their insurance, but there is some specific language in the law regarding parents and guardians not being responsible. And then lastly, just a few technical details, particularly for those of you who are healthcare providers. The consent is not subject to disaffirmance because of minority. So what does that mean? If you are providing services to a 17-year-old and you're doing that correctly under the law and you're not negligent in any way, so you're living up to your responsibilities as a professional, then the minor can't come back later and say, oh yeah, but I was only 17, I didn't really mean to consent. Or, well, I'm going to sue you because you saw me and provided me with treatment and I'm not 18. The law actually provides protection for both of those things. Now, of course, if there's actual negligence, that's a completely different story, but there wouldn't be any kind of liability simply based on the fact that a provider provided treatment or medical services to someone under 18. So there's some protection there. Okay, so I wanted to give you that really quick overview, but I think this is going to make a lot more sense when we see how it actually can work in practice and also see how it hopefully does not work in practice. So we have a couple of role plays for you so that you can kind of get your feet wet on how this would work in a real life situation. So I'm going to turn it over to our actors for this role play. We have Teresa, Naraya, and Melissa. Pam, also, I didn't even give you the chance to introduce yourself earlier, so please go ahead and introduce yourself maybe before we even start the role play. And then Fernande is going to be one of our commentators when the role play is over. So I will stop talking now and turn it over to our scenario acting team.
Pam, do you want to introduce yourself real quick before we dive in?
And I'm Pamela Gerges. I'm a pediatric nurse practitioner. I've been working with homeless youth with the partnership with Nevada Partnership for Homeless Youth the last 4 years, working with youth, providing free healthcare and for emergency shelter clients, independent living, and also drop-in center clients that come to Nevada Partnership for Homeless Youth.
Thank you so much. Yeah, and just to maybe give a slight bit of context, since we don't have a set or anything like that. So this first scenario takes place, we're starting in a school, and we're walking down a hallway, and I'll be playing a school counselor, and Naraya will be playing our young person, and Pam will be playing a worker at CVS, which you will see. Right. Hey, what's going on with your eye? I thought you were going to get that taken care of.
Yeah, I have some stuff going on and I couldn't get there. Maybe we could talk about it later in your office. My friends are waiting on me right now.
I'm not going to be around later. Is this because of the fight that you had with your parents? Yeah, I told you can go to the doctor by yourself. I mean, there's a state law that requires doctors to see you on your own since you don't live with your parents. Just go to the walk-in clinic at CVS.
Yeah, okay, I'll check it out.
Cool.
Hi, I think I have an infection and I need some antibiotics or something.
Huh, it says here you're only 14 years old. Where's your mother? I can't even look at your eye without your mother or father here.
I don't live with my parents, and my school counselor said you could see me without my parents because I don't live with them.
Who told you that? That's illegal. People at your school have no idea about what a healthcare provider can or cannot do. I wish people would stop sending kids to CVS with these complaints and false information. We don't deal with situations like this. Come back with your parents or just go somewhere else.
But I don't know where else to go. I have an infection for a while, and my boss said I couldn't come back to work until I get it cleared up. If I can't go to work, I'm going to be back on the streets again. It really hurts too. Please, I can't. Just look at it for me. My school counselor said there's some law in Nevada that says you can help me because I don't live with my parents.
I told you, your counselor is wrong. No doctor is going to treat you without your parent. Go back home where you belong. Get your parents to take you to the doctor.
Wait, is that my part?
Oh, no, that's the end of the role play. And now we're going to talk about what went wrong in this scenario. Thank you, Nora. Excellent job.
Okay.
So Melissa, you were the school counselor. How do you think you handled this particular situation with this student? Did you do a great job or maybe not so great?
No, that was not a great job. So I think right, there's a couple issues here that we have in this role play, right? One, of course, I think the school counselor was a bit judgmental and impatient, right? So we have that, right? But in addition, right, the school counselor didn't provide the young person with the tools that they needed to access the care. Right. And so I think that of course their tone and their impatience and their misunderstanding in a way of the law and of what to do, huge problems, but especially they didn't provide the young person with the tool. And we know that they could have sat down and provided the young person with a letter that verifies their unaccompanied status and that they are experiencing homelessness and whatnot. And they could have given them a letter and hopefully also guided them a little bit more to how to access the healthcare from hopefully a provider too who is aware of this law, which we're going to see soon. But yeah, the counselor definitely made some mistakes there.
And if I could just add one more thing about the counselor, if you read the scenario that was printed, it says that it's in the hallway of the school and the student has other students around, other people. There was absolutely no privacy at all afforded to the student, or no, respect for the student and what they may or may not want other people to know. So I think that's also a big component.
Absolutely.
Thank you, Fernande. Really important. So how about Pam? You probably have some things to say about the CVS healthcare provider.
Yeah, I think as any healthcare provider, whether you can see a person or not, the provider doesn't even look up at the computer, doesn't give the youth the respect that they deserve. Even working with homeless youth the last 4 years, I found this a lot with other offices, especially specialists or even other primary care providers, because we're not used to seeing minors without adults, but a minor should be given the exact same respect, if not more, than an adult coming into an office, because they deserve that care, they need that care. If you don't get it and help them, a kid with asthma could end up in the hospital, a kid with diabetes could end up dead on the street. So it's huge that we give them the respect and the tools that they need to access services.
Thanks, Pam.
And I think as a homeless youth or even anybody, I would be terrified to go back to a doctor or a provider to access care. So I think even if they are able to access care, now there's that fear and lack of trust, especially with homeless youth. You've been let down so many times. It's already hard to build trust with somebody. So you want to be able to build that trust and engagement and collaborate together with the youth.
Thanks, Pam. Let me bounce back to Fernand again. What do you think in terms of the actual law, AB 197? I mean, the school counselor said one thing, the CVS person said another thing. How should this really have worked legally for Naraya in this situation?
I think as Melissa may have said earlier, the school counselor should have taken the time to explain the law a little bit to the students so that they know, or the youth, so that they have an idea of what they're talking about, not just there's some law, so that they know what their rights are, and provided the letter that's given as a sample in the materials, and counseled them more on where, perhaps help them know where to go, who to see, what to ask for. I mean, if it were me, I would even print out, the law is very short. It's like, a page, two at the most. I would probably hand them a copy of it so that if they encountered that problem, they actually have it right with them.
That's a great idea. Thank you. And as Fernand said, all of these different resources are in that Google folder that's in the chat. Naraya, I'd love to hear from you. Kind of, what was this experience like for you? What do you think it would be like for a youth who actually faced this kind of interaction with people?
It's pretty bad. I've been through it before, where they tell me, oh, you have to contact someone in order for us to look at it. And it's kind of like I really didn't understand it at first, because my case manager, well, my old case manager would tell me, oh, you're allowed to go to the hospital without a parent or guardian. So I told her if she can at least like write me a note or something to take to the doctors to say that I'm on my own and I have no parent or guardian with me. So it was kind of frustrating when I was going through it, but yeah.
Thanks, Naraya, and thanks to all our actors. That was great. We've got one more role play for you, and this one's going to be, I don't want to say better because you all did a great job acting, but the outcome is going to be a lot better. So I'm going to turn it back over to our actors again for our second role play.
And the context for this role play is that we're at a youth service provider's office, so somewhere like MPHY or a youth homelessness provider's office, and we're in a private office area now, sitting at a table. Hey, I'm so glad you came in today. How have you been?
Okay, except my eye really hurts.
Yeah, I noticed it's very red and swollen. It looks like it hurts a lot. Would you be interested in going to see a doctor or nurse about that?
Oh, definitely.
Great. It can be tricky to find someone who will see you without a parent, but there's actually a state law that gives you a right to get medical care on your own. This law was passed last year, and it's called AB 197, and it lets you bring a letter that shows that you're living separately from your parents or guardians to bring it to a doctor or a nurse or a medical provider who can provide you with the services. So I can give you a letter that has all the information that the doctor or nurse is going to need. And also, why don't we make an appointment right now with this doctor that I know? Because she totally gets the law and she'll be happy to help you out. Hey, is Pam there? Oh, okay, thank you. Yeah. Hey, so we have a young person here who actually is in need of some care today. Do you have an appointment available later today for her to come in? Yeah.
Absolutely.
2 o'clock.
We'll be happy to see her.
Perfect. Thank you. Okay, we're all set. Here's the address of the office. Let's look at the bus schedule together and to figure out the best way for you to get there. And if you get lost or run into any problems at the office, just give me a call.
Thanks. Oh, I have something wrong with my eye. It's been hurting and red for about 3 days. My boss won't let me come back to work until it's taken care of.
Yeah, we'll be happy to see you. You must be Naraya. Welcome. We're so glad you could come in today. Let's get you all taken care of. I'm going to take a look at your eye if that's okay. So if you can just hold your eye open, we'll take a quick look. Ouch, that does look painful. I'd like to take a closer look at your eye so we can see what's wrong and set you out with some treatment. We'll probably give you eye drops and an antibiotic pill. Does that sound good to you?
That will be really helpful. I can't afford to miss another day of work.
Is everything clear to you? Do you have any questions? Okay. If you don't have any questions, this is a really common kind of infection. There's nothing for you to be too worried about. We can clear this right up with some drops and antibiotic. Here's a prescription. You can get it filled right down the street. They know us and will fill it quickly under your insurance. You'll need to take the antibiotic twice a day for 10 days, and the eye drops, you'll put 1 drop in your eye 3 times a day for the next 7 days. There shouldn't be any side effects. Do you have any questions? No? Would you like me to write a quick note to your boss to explain this is a minor common eye infection and it won't be contagious with some basic precautions?
I'm sorry, I'm kind of confused.
Would a note be helpful, Naraya, for your
Yes.
boss? Okay. So if that would be helpful, no problem. I'll type this up really quickly now and you'll be all set. Make sure you start taking the medicine right away this afternoon, okay? And you come back and see me anytime you have any health problems or questions. We'll be happy to help you.
All right. Great work, everybody. So this situation was a lot better than the last one. And let me start with Naraya and also Teresa, if you have anything that you want to say, because you've witnessed both of these now. What did you think worked well about this second one? If there's anything that didn't work well, tell us that too. But what do you have to say about the experience of the youth in the second scenario?
I really appreciate the way MJ like explained the bill. It wasn't just like, oh, I have this bill that's for homeless youth, and here you go, you get to go see a doctor without no worries. Like, no, it's like I understand that you're away from your parents, so here's a bill that's going to protect you and allow you to get your eye looked at without like no problems. Like, I think even taking the step of like getting the bus route like taken care of and getting that call, like, because like it's so hard to like as a youth like actually make those calls, because you're just like, well, I'm not 100% certain that this is going to give me the answers that I need. So MJ making that step, like it's certain, like, it's a very much certainty that youth need, especially in these like situations. So I really love that the most. Well, it just all of it all together, just the youth, I mean, the service provider and the health provider working together, I think that's like the most crucial part about this. And so for the health providers out there, like if you guys can reach out and like, or service providers can reach out to health providers, I think making a connection and like doing warm handoffs is going to be the biggest thing like for these youth in these situations. So, but it was amazing. I love the happy ending.
Thanks, Teresa. Naraya, do you have something you want to add?
No.
Okay, cool. Thank you for your acting. Now,
If
how
I could
about, yeah, please
comment?
go ahead.
I'm sorry. Just so that people know, providers know, and service providers, although the law was introduced as Assembly Bill 197, it's now codified, and it's Nevada Revised Statutes 129.030. So that is really where, where it was put into effect. So it's fine to know it was Assembly Bill 197, but moving forward, like going to a medical provider or a hospital, it would be the Nevada Revised Statute that's controlling.
Great,
Which says
thank
the
you.
same thing, but it says a little more. It's like the complete version of the bill.
That's really important. And those sample letters that are in the Google Drive that we shared, they do cite that law, and they even have a link to it. So like Fernande said, you could print it out and have the actual law with you too. So that's really important. Pam and Melissa, what did you think worked well in this scenario? And if there's anything that you think maybe didn't work well, that's okay too. But what did you think?
I think it's the warm handoffs are huge. I think it really helps providers and even front desk, because a lot of times a youth comes in, the medical provider may not be the first person they see. There's always the front desk person, and someone may change out. So having that letter, and then even just having that warm handoff so they know they're coming, it really helps. And just being open, friendly, inviting. And then I think anytime before you leave a room, it's really important to say, do you have any other questions? Stop, wait, and listen, because that's where the real reason someone's coming in comes out. The other thing I like about the scenario is telling them where they can get the prescription filled. or how to get it filled, because once you see the youth, sometimes the next barrier is trying to get a prescription filled. And that's where it's great to be able, if there are barriers, you're not for sure where to go, to work with case managers at MPHY or another service center, because they can actually help the youth access critical things like medication or durable medical equipment, or even if they need to be referred to a specialist, making sure that warm handoff goes back to their case manager. One of the key things there is you have to get consent from NARIA or the homeless youth at that time, because as a provider, I can't share anything with a case manager unless the NARIA or the homeless youth gives me that permission. But it's really good to be able to then warm handoff back if they need to see additional providers. So the next letter can be sent, another warm handoff can be done.
Absolutely, totally. And I agree with all of that. And also with everything Teresa said, I think that it's really, really important for the service provider to, of course, with providing any service, be empathetic and open and listening and all of that. But I think that also it's just very important to provide them with all the tools you can possibly provide them with. So providing them the information about the law, the context, giving them the letter, explaining what the purpose of the letter is, helping them set the appointment if possible, providing them the transportation information on how to get there, et cetera, et cetera. I think exactly like Teresa said, just walking through from A to Z and providing them all the tools that they need to make it as accessible as possible so that they're able to immediately access that service. And yeah, being able to answer any questions that they have open to that. And exactly, a warm handoff is of course ideal. Anytime that we can do a warm handoff and work together with another trusted agency that also understands the law and understands how to work with young people and understands their rights is absolutely ideal. But of course, when that doesn't happen, if there's an agency or a school or whoever who doesn't have a relationship like that built up, or they're not available or something like that, of course, the work that we're doing to try to inform more people about this law, hopefully we're still able to work with all kinds of healthcare providers to provide these services and to really, just like Teresa said, educate the young person on what their rights are and give them the tools so they can access that.
And
Thanks, Melissa. Yeah, Fernande, please.
I'm sorry, I didn't mean to keep, from the provider's perspective, the only thing that wasn't really emphasized in that scenario is that the provider is supposed to ask the youth, is supposed to make reasonable and prudent efforts to ask the youth if it is okay if they contact their parent or legal guardian. And it's easy to gloss over that, but the statute also says that they're supposed to make a note of that in the patient's file, or if they deem that they shouldn't ask because it'll scare the youth off or make them not get the service, then they're supposed to make note of that. And that may seem inconsequential, but many of these services will be paid for by something like Medicaid, and not making the correct notes in the patient's file could be something that would cause them to deny payment. So I know that's not from the youth's perspective, but since we do have a lot of providers, I think it's something that they should be cognizant of, that they do need to make that inquiry and make that note, especially in the patient's chart or file.
That's a really important comment, Fernande. Thank you. Absolutely. Well, I hope that actually seeing the scenarios were helpful in terms of kind of operationalizing this and thinking about your own role, whether you're with a school, a shelter program, a service program, whether you're a medical professional, to just kind of see where you would fit into that scenario. And now I'm going to jump into Q&A. And what I'm going to do is just kind of go through the questions that have been typed in. If you have additional questions, please feel free to type those in. I may have lost early questions. If you typed a question in the first 10 minutes, I may have lost that one when my internet went out. So feel free to type it again. I won't mind if you enter it twice. But let me just go ahead and start with some of these questions. And let me start with you, Fernande, if you don't mind. Someone is asking, do the youth have to be living apart from a parent or legal guardian or custodian for a certain amount of time?
No, they do not. They have to be living apart from the parent or guardian on the day they seek treatment. It doesn't matter if it happened that day or if it happened, months ago. It's just at that moment, are they living separate and apart from their parent or guardian?
Okay, great. Thank you for clarifying that. Let's see, I think I'm going to maybe ask Pam to take this one, and you're welcome to refer the question to somebody else too. I'm just trying to make sure that all of our panelists get a chance to chime in. So Pam, let me know if this one sounds good to you. Someone is mentioning that at their agency, the procedure is if a minor comes in, They want to ensure that the minor has parent or guardian consent for services. And if they don't, then they want to make sure that there's someone who has been designated temporary guardian by some kind of a notarized letter that has to be updated every 6 months. So the question is, with this law, can we change that procedure to provide more flexibility?
Absolutely, you should be able to change the procedure, because the letter that you're getting from the service provider, whether it be the school counselor or MPHY, that's showing that that youth is unaccompanied minor or homeless. So that shows that they meet the law requirements. So you can use the letter in place of that. And then, like Ferdinand said before, once they're in the back and the provider's documenting, make sure you document that you made efforts to contact or ask a parent to. And I don't know if Ferdinand or Melissa has anything to add to that. That letter suffice in place of.
Yeah, I mean, the only thing I would potentially add is not only can they, but I think they must change their procedures, because the law is not you may, it's you must. So they're required to treat a youth who is not living with a parent or guardian. So to require the letter, or not the letter that we're talking about, but to require the temporary guardianship or the things that were in the question would not be permissible under this law, because you can't deny treatment.
Terrific. Thank you both. I'm going to ask Melissa to weigh in on this one, because we have a couple of questions around this issue of prescriptions. And I'm thinking that you all at NPHY might have, contacts or procedures. How do you help youth access prescriptions, get them filled? And how about payment? Are you able to get those covered by insurance?
Yeah, that's a great question. And I actually think Pam can answer this in a way. Pam, you start, and then I'll add about how we pay as well.
So currently, Nevada Health Centers has a mobile medical unit that comes to MPHY at least once a week, and youth can receive free health care on the mobile van. With that, the medication, if they don't have insurance, is provided for free through grant funding for kids seen on the van. And then the medication is delivered to the youth or to MPHY's drop-in center. For youth with insurance, I've always sent the prescription to their pharmacy of choice. And as long as they have a Medicaid card, no one, or I've even provided them with their Medicaid information, because a lot of the youth don't have their cards, but you can look them up on the Medicaid websites and give them the number. They're usually able to access their prescriptions at any CVS, Target, Walgreens. I've never had many issues sending them to any of the major pharmacies, as long as they have their insurance card, even with them being a youth. And then what I do, I also tell them, if they're going to a different pharmacy, is have that letter just in case, or I'll make a copy of the letter if I have it, showing that they have the right to access care to take with them to the pharmacy. And then if they don't have insurance, my only other thought is, if they don't have insurance, is using GoodRx. So in other practices, I've used GoodRx with them, and I'll print out the coupon code so they can access it a little bit cheaper, or work with a case manager at MPHY, because sometimes MPHY will have grant funding if it's one of their clients too for medications.
Exactly. And at MPHY, we're very lucky to have that partnership with Nevada Health Centers. And I know not every service provider has a healthcare partner like that, that's able to facilitate that. But definitely, I'd say that, we work with all of our youth to find out whether they do have Medicaid, or if they don't have Medicaid already, to help them sign up for Medicaid. So definitely very important to help them access insurance, or sometimes we are helping youth to obtain employment, and they are able to get insurance through employers, or sometimes through the marketplace, et cetera. But so we definitely prioritize working with young people to obtain Medicaid or other types of insurance, and to help them know how to utilize that and whatnot. But then, at NPHY as a service provider, we do also seek funding, grant funding, other types of funding, to be able to pay for medications when needed. So we also can provide for the young people in our programs. We do obtain other funding, so we have that available. So if there is a prescription that's not covered, or they don't have health insurance at the moment, or things like that, we can actually pay for that. So that's definitely something else we'd recommend to providers to raise some funds, particularly for medications as well.
Thank you. I'm going to ask a quick follow-up to that one to both of you again, and then I have a couple for Fernande in the queue, but just a quick follow-up on this issue, because someone is asking, particularly for youth in rural areas, and particularly if they might not be eligible for Medicaid. Do you have any suggestions or any resources that you can share for rural areas to help youth get services or prescriptions paid for? I know
So
that's a tough question.
once again, I use GoodRx a lot. I will pull up the codes. I pull up $4 list at the closest retail pharmacy that they have. And then for a lot of the patients, I have some who are on $2,000, $3,000 medications that they have to take all the time. And of course, our grant funds cannot cover that. So a lot of times I will actually call the manufacturers if I can't change to something cheaper. And I've been able to get funding straight from a manufacturer of a prescription by going on their prescription discount, because a lot of those, the manufacturers of prescriptions, whether it's Johnson & Johnson or any of the other ones, Pfizer, they have assistance programs. And if you say, I'm working with a homeless youth, they don't meet the income guidelines, they will actually help provide a lot of the medications, sometimes free or a very low charge. And then GoodRx, I love it for even sometimes with people within private insurance, it's still cheaper than paying with your insurance for medication.
That's great. Thanks, Pam. All right, I'm going to bounce back to Fernande again. I got a few quick questions. Is there a minimum age to this law for youth to be able to use it?
No, there is not. The youth does, however, have to be able to understand the nature of the services to be provided, the potential outcomes, and also be asking for the services to be provided. So they have to have some, cognitive level of understanding, but there's no age limit.
Okay, terrific. Thank you. And that kind of gets to another question about how this might relate to a child with developmental disability or maybe some cognitive limitations. And it sounds like you just have to be able to be sure that they do understand what's happening.
Yes.
Now, can you tell me also, what if a youth can't get a letter from one of those people who are listed there in the law? Does that mean they just can't get the treatment?
No, there's some other forms of documentation, anything that would show that they are living separate and apart from their parent or legal guardian. The documentation could be something to do with a proceeding in court, a neglect or abuse petition. It could be a petition for emancipation. It could be a decree of emancipation. There's some different types of things. It could be a letter from an attorney who's involved with them in the court proceeding, saying that they're or not, doesn't have to be a court proceeding. That's just another form. But an attorney who's involved with that youth in any way can also provide a letter.
What about if it's just maybe a community center, a boys and girls club where that youth is participating, and they have that kind of a letter that to provide support just for the notion that they are living apart from a parent or guardian? Would that be something that a healthcare provider could kind of hang on to or put in the file?
It's a counselor. I'm trying to. A school social worker, a school counselor, or person designated as a local educational agency liaison for homeless children. So I don't know if a boys or girls club would really qualify under that. But it also says a not-for-profit. So.
Oh, right. Okay.
Yeah, or a nonprofit agency or their designee. So that's also possible. So I think that is acceptable, actually.
Okay, terrific. Thank you. I'm going to open this one up to anyone, whether it's, any of our adult experts or our younger experts. Does this apply if a youth is, actually, no, that was not the question I wanted to ask. I did want to ask Fernande this one. Sorry, everyone. I'm going to just target this one to Fernande. Would this law help a youth who is living with their parents and maybe they want to seek some mental health treatment and their parents are not in favor of mental health treatment, but the youth is living at home with the parent?
No, the first requirement is that the youth be living separate from their parents or a legal guardian. The only way that it would apply is if the youth left the home, went to stay with a friend, because if you're living with a friend, then that's not a legal guardian because there's no court appointment appointing them as legal guardian. But then you have to cross the hurdle of having proof that the youth is living apart from the parent and not just gone for, a day. So as long as the youth is living with the parent, it does not apply.
Okay, Thank you for that. I'm going to give you a rest for a minute, Fernande, because I want to go. I think this might be a good one for Melissa or perhaps for Teresa or Naraya. What about young people who don't have IDs? What suggestions or resources do you have to help a young person be able to get an ID card? Because they might need that. They might need that to apply for insurance. They might need that for a lot of things.
We actually have a bill to support that as well. It's AB 363. We passed that a couple years ago, and it basically waives the fees at vital records and at the DMV, so they can access those, a duplicate or like a new ID. So I would suggest them to go to their service providers to access that first, and so they can have, so there's no other hinders like moving forward.
Yeah, totally, definitely. And something to build on, kind of a theme that's coming out in these questions, which I kind of want to address too, is that if a young person shows up without a letter, without needing ID or needing other resources, this is a great opportunity to refer a young person to a service provider, right? So if of course they may be coming in with an immediate health need, but if the health provider is aware of a youth homelessness agency or other agencies in town that can meet some of those additional needs, this is a great opportunity to connect them. So if they're coming without a letter, it's a great opportunity to be like, oh, actually, have you heard of MPHY, or have you heard of these other agencies, or have you heard of, and to try to even give a call, and make that connection, because it's two ways, right? The service provider agencies can refer to the healthcare providers, and the healthcare providers can refer to the service agencies. So it's a great chance to be like, let's connect you, and then they can assess you for services. They can provide you a letter. They can help you get an ID. They can help you, et cetera, et cetera. But exactly, all of the youth homelessness service agencies, at least we know in Southern Nevada, do help young people to access their identification documents. And exactly like Teresa said, because of the law that we got passed in 2019, which was known as AB 363 and now is Nevada Revised Statutes, as Fernande will tell us, that now enables young people to access identification documents with no cost. So, and that includes state IDs, that includes birth certificates, et cetera, et cetera. So yes, we do have a capability of doing that, but it's also a great opportunity to refer youth to other service providers.
And just one more thing that I didn't mention is that in requiring proof that the youth is not living with their parent or guardian, that's assuming that the medical matter isn't urgent, because the statute also provides that one of the provisions to provide services to the youth is if the youth is in danger of suffering a serious health hazard if healthcare services are not provided. So, I mean, if it's an emergency or truly urgent, then you don't need that letter beforehand.
That's great. Thank you. Melissa, I want to ask if you don't mind, if you have a chance. I know that you all, or maybe Teresa, whoever has easier access to this, I know you have some information about the ID and birth certificate fee waivers on your website, if that's a link that you might be able to pop into the chat for people to access. And then in the meantime, Fernande, I'm going to ask you again, a couple of people have asked you to repeat what you said about the note to make in the chart regarding efforts to ask the youth if it's okay to contact parents. And so if you could just describe that again. And also people are asking, do you have to make that inquiry about parental contact at every visit? Like if the youth comes back 2 or 3 times and you've already asked them on the first visit, do you ask them on every visit, or does it matter?
The statute doesn't specify about every visit, but as a cautionary measure, I would suggest that it should be asked at every visit, because lives fluctuate, things change, and each visit is a separate service, so a separate billing. So it should be in the chart, I believe, for each visit, just to ensure the service provider doesn't have a problem with that. And what the statute says at subparagraph 4 is that a person who provides an examination or services to a minor shall, before initiating the examination or services, make prudent and reasonable efforts to obtain the consent of the minor to communicate with his or her parents, legal guardian, and shall make a note of such efforts in the record of the minor's care. And then it further provides that it's not necessary to make the efforts to ask them about their parent or legal guardian if the service provider believes that the minor's life or necessary services are needed to avoid serious and immediate threat to the minor's health. So to me, that means like if you think by asking the minor is going to walk out of your office or not going to stay for the services and that's going to be harmful to that youth, then you don't need to ask them about the parent's consent, which would go also to your question, like if you've asked them before and they really had a very adverse reaction or they got upset or walked out, then I think that would be an exception. But you also need to note that why you didn't ask them. That needs to be in the chart, in the record.
Perfect. That's really helpful. Thank you. One person sort of pointed out that this is a Nevada state law, so of course it only applies in Nevada. I'm just going to pop into the chat a link where you can find these laws state by state. So if you have a youth who's crossing into California or moving halfway across the country, you can get information on those laws in other states. The majority of the states do allow minors to consent for different kinds of medical care when they're not living with a parent or guardian. So you can get that state by state information on that website. And then I think the last question, I'm gonna ask Fernande again, sorry to put you on the spot so much, but how does this law apply to undocumented minors or undocumented youth who might have come to this country on their own or have been separated from their parents since?
I think you would have the same issue that you spoke of earlier with some sort of identification for the minor. I mean, it doesn't require that a minor be a citizen. So I think if they have some kind of proof of identity, who they are, that would take care of that part of it. If they don't, then you really need to do the same thing as you would for a youth, an unaccompanied youth who is a citizen, but doesn't have any proof of identity. So the comments that Melissa made earlier, you know, of referring them maybe to an agency or a service provider that could assist them would still apply. I mean, it's the law should apply equally, the same to whether you're a citizen or not a citizen, documented or undocumented.
Great, and thank you for clarifying that. Oh, please go ahead.
Yeah, and I do want to mention that there are also some other forms of ID that, in addition to birth certificates and Nevada IDs and whatnot, if it takes a while to access those or there are barriers to accessing those for a variety of reasons, many service providers are able to offer, at least in Southern Nevada, something called a Clarity ID, which comes out of our homeless management information service system, and we can provide that. And some providers do accept that as a form of ID. It kind of depends on the provider, but that's a more immediate form of ID that we can provide to people experiencing homelessness that sometimes allows them to access some other services. So that's a type of ID we can sometimes provide, but then we definitely will assist to get the more traditional forms of ID when needed as well.
That's a great resource to know about. Thanks, Melissa. All right, let's see. I'm going to ask everybody to do another poll for us really quickly. This one only has 2 questions, so it will take you even less time. How did we do? Do you feel prepared to implement AB 197 in your role now, whatever that role might be? If you're a youth, do you feel prepared to use it? For yourself? If you're a provider, do you feel prepared to implement it? And if not, or even if so, what additional support would be helpful? What else can we do to provide you with more information and more tools so that you can definitely feel comfortable implementing this law? So while you all are answering that, I have advanced the slide so you can see these are hot links. Of course, you can't click on them now, but if you go into that folder in the Google Drive, you will be able to access this PowerPoint. You'll be able to click on those links. You can get, as Fernande said, the actual text of NRS 129.030. You can get the Q&A, you can get the flow chart, and you can get some sample letters. I did see some suggestions to edit those letters coming in the Q&A, and I will go ahead and make those edits as soon as we get off the call. So those will be available to you momentarily. I see that most of you have answered the poll, but I'll go ahead and give you just a few more seconds to answer that. And then we will see how we did. Okay, I'm going to close the poll now and share it with you. Well, most of you said yes, either very much or somewhat. So I feel good about that. Again, I do apologize for that horrible interruption in the middle of the presentation. Internet goes wrong sometimes. And I can see some of what the additional support that you would like. So we'll be doing some work to make sure that you get those tools and information. Some of them are in that Google folder already, and others we will look to provide those opportunities and those tools for you in the future. So I would like to ask our panelists if they have any final words that they would like to share. I'm going to start with our friends from NPHY. Any final words or suggestions or advice for our attendees?
I think I want to thank everybody so much for their time today and for joining us. And I hope that this was helpful. And I hope that you spread the word to other providers that you know, other healthcare providers, other youth homelessness providers, or just other education providers, just others in the community that you know this would be useful for. As the wider we can spread the word, the better, and more young people will be able to access these services. And don't be afraid to look for other partners in your communities. And this webinar is for the whole state. So getting to know other healthcare providers in your community, getting to know youth homelessness service providers in your community, or others, so that we can make those more effective warm handoffs whenever possible, is excellent and will help us to facilitate youth's access of this law. So, but thank you again so much. And please feel free to reach out, check out our website, mphy.org, mphy.org/the movement, check us out on social media, and feel free to send any questions that you have for further clarification.
Fernande, anything that you would like to add from legal services?
The only thing I would say is that, legal aid does take pride in being a community partner. If someone does have questions, more than happy, whether it be myself or someone else here at the Children's Attorneys Project, we are more than happy to either mentor or assist or lend, expertise when we can, whether it be to providers, obviously to youth, always. But, even to providers, community partners, we are always remain very, very willing to participate and assist.
That's great. Thank you. And Pam, I saved you for last as our healthcare provider and expert. Anything that you would like to share with your colleagues and peers who are on the line?
Thank you guys all for taking the time to attend. And as a provider, I would say just take the time to listen to youth and be open. And if you have questions, reach out. Just don't shut the doors on youth and case managers, because a lot of times youth have nowhere else to go. And if you shut the door on them, they may assume that everyone else is too. So our goal as providers is to be there for youth and everyone we serve, and help them to want to continue to access healthcare and preventative services. And I really feel by this law, working with youth over the last 4 years, it's kept kids out of the emergency room, kept kids from having asthma exacerbations, and and a lot, especially with mental health, has kept a lot of kids from being off of medications and not able to access healthcare services, which leads to suicide and other problems too. So my advice would be just be there, be present, listen. And if you have questions, you don't understand the law, reach out and ask.
Thank you, Pam. Thank you so much to everyone for taking your time to join us today. You will receive a follow-up email that should include a link to the recording so you can share it like Melissa suggested, and also contact information so that you can get in touch with us if you have any questions. So happy afternoon to you all. Thank you so much. And we appreciate your time, and have a nice day.